Thank you very much, Flavia, for the presentation, and also to Alessandra for opening the session. So colleagues, we're now in the Q&A stage. I see a couple of questions were raised, but please feel free to raise your hand, and you can come in live and ask your question as well. And as we do that, maybe, Flavia, we could clarify that any colleague, any individual from any agency can access the UN Booking Hub app or website, and they can access the medical and wellness services in the country offices that's available without the need for their agency to have any kind of agreement. If you can confirm that. I know you covered it, but just because many of the colleagues that are listening into this webinar and the recordings might not be a service provider of the medical services, but they might be the recipients of the services at the country level. Over to you, please.
Absolutely. Thank you, Zamir. So to use the platform as a final user, there is no charge and no agreement to be signed. You can, as I was saying at the beginning, you can just log in with your credentials and navigate the platform and see the services which are available to you. The important thing to note is that each service can be customized in terms of visibility, meaning that if you log in and you see a specific service, this means that this service is accessible to you and that you can book it. So there is no agreement needed at this point. The only agreement we need to sign is with service providers who would like to make their services available to be booked through the platform.
Perfect. Thank you so much for clarifying that aspect. Colleagues, feel free to raise your hand if you have a particular question. Otherwise, we'll go through what we have in the list in here. Maybe another quick one, Flavia, because the medical and wellness services is a very particular service and not necessarily in all of the country offices, but mostly in those that have medical setups run by UN. Can you clarify at the moment how many, I mean, not necessarily exactly, but in general, how many country offices are using or how many countries are using the medical services platform, and which agencies are currently on the corporate side of using this platform at the interagency level?
Yes, sure. So the platform is used at the moment in 16 countries and is all WFP field clinics, some UN, actually mentioned UN clinics, and some UN clinics run by UNDP who are piloting the system. And finally, UNON, who is the United Nations office in Nairobi, is using the platform to manage all their service lines within the country, so in 3 different locations.
Perfect, thank you. Jose, you want to go next, please?
Yes, yes, thank you.
Sorry,
yes, of course.
Can I come in on something, and maybe that's just an open discussion on what we have seen in the past in terms of adoption of the solution that I just wanted to specify very clearly, and it was obvious from, let's say, Flavia's presentation. We are not aiming at managing anything about specifically medical, technical, and vertical aspects, okay? What we want to do is to support the administration of whatever it takes to get a person from thinking about needing or wanting to have a medical exam, visit, or whatever, okay, and service, and get to that provision. So our, let's say, vision is try to automate over time as much as possible the organizational part of this aspect, okay, to focalize entirely the let's say the time of medics and medical staff, nurses, instead of administrative aspects to manage the visits, but just specifically to, you know, their medical part, because there is a platform that thought about the entire plan. And so I think in the past, when we were confronting something that was these aspects where people were thinking that we wanted to provide some type of medical services or solution, no, we want to make sure that the demand for medical services and the offer of those medical services, they are connected in the most simplest way and also the most automated way for nobody to spend time on administrative aspects. So I think understanding this part is really important for the scale up of the service, because we really think that these aspects can really be a benefit and bring efficiency gains to everybody managing today a medical service. So over to you, Zamir and Jose. Oh, sorry if I maybe interrupted you. Over.
No problem.
No, I think,
thank you.
Yeah,
Go
yeah,
ahead, Jose,
I think
please.
it makes a lot of sense what you're saying, Alessandra. My office sometimes when they organize some of these ideas, these initiatives, they use SharePoints, and regularly it's very complex for the organizers then to realize, if it works, if it doesn't work, people forget to attend. So it's a great detail that you're mentioning that. So I'm curious about the how does the platform performs over like, let's say, complicated environments where internet connection is not always the best. I think I already may have gotten the answer to this, but I would like to know a little bit more. Maybe Flavia, you can help us here to understand how is it for clinics to operate in complicated environments, and how is it for the patients that are applying to are soliciting the appointments. Over.
Thank you, Jose. Absolutely. So for terms of patients requesting appointments, there is a mobile app available, and for all services actually, including medical and wellness ones. And in the app, the appointments can be sent even offline. This means that they can create, if it's an instant functionality, they can request the appointment and it will be processed once they're back online. And for a standard booking, it's the same. They can send the request as soon as they're back online. So especially in environments with the, let's say, low connectivity or let's say interruption of connection, this can be managed through that. In terms of management, the use of the platform requires a connection, but we have some cases in which they can be also managed remotely, meaning that you might have a deep field clinic, but the management of the platform is done actually in another location where the connectivity is better, so that they can manage remotely, and then of course they can access the appointments there. But for more, let's say, for more complicated changes inside the scheduling, this can be done remotely by other colleagues who support from another country actually, or from another location. I hope I replied to your question.
Yes, very well. Thank you. Maybe we can give the floor to Carolina, who has just raised her hand. Over.
Thank you, Jose. Hi, colleagues. Thank you for the presentation. And I think it's very interesting in my country for counseling services. I just wanted to know because, for example, in UNICEF, Cigna covers the reasonable cost that we have in our on-duty station. But, for example, if someone is traveling or the service is rendered by a professional that is not in Ecuador, and the service is more expensive, how can we deal with this? We can check the cost before scheduling an appointment. This is, if you are on mission, it is covered. But if you want, for example, these counseling services, I'm afraid maybe they're going to be more expensive than here in Ecuador. And my other question was regarding if you have been able to measure how time savings, workload for HR operations staff in duty stations. In the duty stations you have been using, if you have been able to measure the impact of the use of this platform. Thank you.
Thank you, Carolina. So for your first question, in terms of, so all information about services are displayed on the page of each service. So if there is the need to share the cost in case for a service which requires a payment, this will be displayed there. For example, I can tell you we have some services in WFP HQ which requires a payment when you are actually over the limit, as you will see with Cigna. So it's the same insurance company. When you're over the limit, you need to pay. And in those cases, of course, the the price is displayed there. So the platform is a tool that allows for any information to be delivered so that the service manager can be, let's say, can provide all the information needed so that the patients can be informed before making an appointment. So this is really up to the service. So if you log in afterwards and you give a look, you'll see that there are really different informations according to the type of service provided, and this can be fully customized. While regarding the, let's say, efficiencies, we have our own methodology to calculate them. I can tell you that we estimated on average that between let's say, compared to handling appointments through email, phones, so what was done before the implementation of the platform, each appointment requires 5 times less time to be processed through the automatic assignments, which is easily actually understandable, since instead of having calls back and forth with the patients and changes, you can just go there and book immediately. So it takes really not even perhaps 2 minutes to make an appointment. So we estimated around $30,000 per year of savings per clinic, so per service actually. And what we need to understand is also the let's say, besides the time saving that can be, of course, that are considered, we also need to understand how much the service gains in terms of quality of service for patients, less frustration with the scheduling, because as a patient, I can tell you, I was here before it was implemented, and you lose a lot of time to book an appointment. Well, now you go there, you see what is available, you book it. It's really quick. So also in terms of quality of service provided, you have, I mean, you gain a lot. And also, of course, embedded tracking of utilization, because if your organization offers, let's say, 3 types of services, through the platform, you can know how much the services are used. And this means that the budget that you reserve to one service that perhaps is underutilized, you can reduce the budget that is used for that service and redirect it to something else. So this is also something that we should take into account when we think about efficiency gains and savings, let's say. I hope I replied to your question, Carolina.
Totally. Thank you, Flavia.
Thank you.
And Flavia, sorry, I
Ale,
wanted also to add something that might be of interest also to Carolina. We have seen this throughout all of the service, because, you know, imagine on our life, on our private life, not the UN one, right? When we book services, why are people using more and more Booking.com or Amazon because the accessibility, making something easily accessible is actually increasing the usage, as Flavia was saying. So it's difficult to calculate and difficult to know. For example, an accommodation where we have we're running customer satisfaction surveys since the last, 8 years, okay? We know every single year we are a percentage that is variable in between 8 to 15% of people, they say, I booked that guest house because it was easy to book, right? So by the same token, when we rolled it out in WFP, the first reason why we started this service was to make accessibility to these services easier, okay? And the fact they are there and that people can know, they go in a place and they see whatever is available and they can just click it, find the date, find the hour, and that's it. That makes really the service not only easier, but really more accessible. People use more medical services for the fact they are easily accessible. And that is a efficiency gain, you can say, you know, in terms of service, qualitative efficiency gain. Of course, efficiency gain can be quantitative and qualitative, which is really difficult to, let me say, to estimate. But we have seen these over and over and over. And for example, right now, also in another service, when we rolled out your mobility, for example, right? So for agencies to use the tool to manage their own mobility. Now we're entering really seriously the phase of carpooling, because if everybody is using the same solution, then you get interagency opportunities there, right? So the more we can use the booking of medical services through the same platform, the more we can add data that we can exchange to each other, and then find out where services are requested more. Should we, as Flavia was saying, should we increase services in that area because there are a lot of missions maybe happening there? or so getting the data and being the same platform can really help annual planning of improved medical services overall. So this is exactly what we do internally with WFP, with our staff wellness director. We review the data and we are part of the conversation how this data influences the way in which WFP provides services to our staff and other staff of other organizations. So that it's a qualitative aspect that I wanted to mention, that it's really improving the life of people. They will tell you it was really easy for me to access medical service, regardless then of the medical service say provision per se. But the fact that it's easily accessible makes already people very, very happy. Over.
Thank you, Alessandra, and thank you, Carolina, for the great questions. Colleagues, any other hands? I don't see at the moment, but feel free to come in. Alessandra and colleagues, we can definitely see a lot of benefits for these services at the field level, but there is also many agencies that have medical services and wellness services in the headquarters. Are you reaching out to some of those headquarter locations to see if the booking hub would be a good basically solution for them? One of them being New York, for example, and here there's a medical service run by the UN Secretariat, but definitely use a different approach for booking. So, is there any? Are you working also with the regional and headquarter locations to embed their requirements into the booking hub medical services, or it's only field facing at the moment?
Absolutely. No, we are open to headquarters and global offices as well, especially now that there is also the consolidation ongoing of all the headquarters and global offices. So this is even more important. Indeed, UNON, which is our client in Kenya, they are an interagency service providing medical services to all UN agencies and even beyond the UN agencies. And in their case, it was for them, it was a mandatory requirement to have an interagency platform, because this is something that, I mean, it's needed, no, in an environment such as that one. Otherwise, you will need to manage 2,000 calendars at the same time and people booking from emails and phones, and it's impossible. So absolutely, yes, is a tool that is valid for headquarters, especially when there are more services available. No, you might have, as I was showing in the demo, in WFP, for example, we have not only primary care, but we have a lot of services provided, and those are available through the same platform and can be managed on and can have the same entry point. So for the patient, for the staff, there is a clear advantage in having access to all of them and increasing their visibility.
Thank you, Flavia.
And Zamir, let me say again, through the experience of the other service lines, we always started low profile because there was a need in the field, and our mission at that time, our ASG said, whoever wants support on ground, we're going to give it to them, right? So we were really like needs-based, let's say, developing our features, because that was where the immediate need came from. But then from experience, when we had enough of these operations showing benefits and happiness of use of the service, it was much easier to go then and reach global agreements at the global level. So absolutely, we're very much in favor of getting, requirements that would be coming from more aggregated or regional or global HQs. By the way, we are already serving global WHQ. So hopefully all of the features that we have are already quite supportive, but open to see any other type of requirements over.
We confide in you to bring New York on our map.
Yeah, of course, we'll talk separately on this. Thank you so much, Alessandra and Flavia. We have another hand raised from Flavian. If I pronounce your name properly, please come in. Your microphone is activated.
Yes, thank you, colleague. My name is Flavien Zitoun. I am the acting director in WHO. Thank you for the presentation. I think it is a very interesting system, and of course it will save time for our admin staff, I'm sure. And also it will be an added value for the staff because they could book an appointment during the evening, they will have access in real time to the available slots. So I think, yes, it will add a great value. I have a question about, my question is this UN booking system integrated with EarthMed, and in particular with EarthMed Healthcare Staff Calendar? So EarthMed is an electronic medical record system that is used by UNDH-MOSH, for example, and it will be probably where the system we will use in the future in WHO. If not, does it mean that they will book the appointment through UN booking, and then manually we will have to put the name of the staff in our electronic medical records? Because then it will mean that we will have admin staff who will have to record the, because for us as a doctor, when we access to the file, we click directly on our the calendar of the medical database, and we have directly access to the record. So is there a link between your system and the UN system? Thank you.
Thank you, Florian, for the question. And yeah, we know HeartMed very well. So at the moment, there is no link, which does not mean that it cannot be done, because of course, through APIs, we can connect to systems. I can tell you that up until now, we haven't linked them for two main reasons. The first one is that we have mainly WFP clinics and we don't use HeartMed. We use another system that is called Cority, which is based on HeartMed anyway, but is customized. And in our case, there was never the need to connect them, because what they do basically, so the hub is used to manage appointments, and as you said, is automatic, so it's really low maintenance for admin staff. As soon as you show up for your appointment, I don't know, because I was a patient for one of the services. You arrive there and the doctor opens on the computer, let's say the equivalent of HeartMed, your card, let's say, I don't know how to call it, your card on HeartMed, and then is registering all the information about the patients. So the main reason, the first reason is this one. The second one is for data security, because connecting to system, of course, it can lead, is impacting a bit the data security. While we wanted to keep the data on the hub, which is of course still sensible, but less sensible than the one of course, the patient historical data, no? So on diagnosis and everything related to the health of the person, is we prefer to keep it segregated to ensure this extra layer of data security. Even of course, our website is is in line and even exceeds the data security and data protection guidelines of UN and WFP. But just in case, we always prefer to keep it separate, because we didn't see so much the advantage of linking the systems. So that since the scheduling is done on the hub, then the patient data is recorded in HeartMed, we kept them separated. This does not mean that if we have a collaboration with another organization and this is required, we can always explore it and see how to make it happen, let's say, if needed. But our suggestion is always to try it. So what we always offer free pilots, because before starting using a system, you might think that something is needed, and then when you start using it, you see in practice that there is actually not everybody is really needed, and perhaps there is something else that is needed that you didn't think about it before. This is our approach usually. So what we suggest is always to try it out, and then if there is any aspects that needs to be refined and improved, we can work on it together. I hope I replied to your question, Florian.
Yes, thank you. I understand. Also, I think it would be, but I would consider that probably it would be better to have an API, because most of the UNDP clinic, or all, use EarthMed. And if you want to have more people using the booking hub, and it seems very a good tool. So I think it would be important to discuss with our colleagues working on EarthMed. I could put you the contact detail of the colleague from the UN working on EarthMed if you want, but probably, as you said, you already know them.
We do have some contacts. I don't know if they're outdated, but we have been speaking every year. We speak with Dimash. So we never reached the point of implementation. So as I was saying, if we reach that point, then of course we can discuss integrations. But we cannot do an integration before actually having a sort of let's say willingness on both parts, no? But as I said, of course, integrations are possible. So I don't see any obstacle on that. It's just a matter of working together and then working towards that point, let's say.
For efficiencies.
Yeah.
Or efficiencies. I was gonna say you got it perfectly. I think it's a perfect time. Of course, the Booking Hub team is very dedicated, and they have been reaching out to different agencies and also have been available in all platforms, OMT engagements, regional engagements, to make sure that they can provide this service, this initiative, to all of the agencies, so that it is an interagency. A real interagency use of the initiative in all levels. But I think I'm sure you're not tired of reaching out, and you will restart this and re-engage in the spirit of the UNAT and the push that's out there in terms of collaboration and consolidation of services. We only have 3 more minutes to go, colleagues, but maybe we may have listeners in this webinar that have services in their country offices, but they may consider it's very small. Maybe there is like very limited wellness services to smaller groups, and maybe there is a desire at the country level, but not necessarily corporately by that agency, to engage in a global agreement. Would there be an opportunity for smaller agencies with like limited scope in terms of their services to utilize the medical and wellness services of the Booking Hub? And if yes, what would be the steps for you? I mean, do they need to go through a comprehensive process, or it's like a quick onboarding process for you?
Absolutely. Thank you, Zamir, for the question. Yes, absolutely. It's open also to local agreements if needed, if required, I mean, actually, if preferred. So the onboarding process is quite easy and fast on our side. Then it depends, of course, if there is any layer of authorization that the organization needs on their side. But on our side, what we do is that we can set up a pilot in even 1 week, and they can start using the system. And if they like it, then we can do an agreement. And the agreement can be local with the local representatives. So absolutely no restrictions on that. And perhaps it can be also a way of starting. No, you can start with different locations, and then if the same organization is satisfied in different countries, then we can reach out to HQ for a global agreement. So absolutely, yes.
Okay, I already see Gulnar raised her hand, and colleagues, I just wanted to announce that we have 15 minutes for questions and answers, and I know that many of these aspects, basically, of the webinar relates to an entity that is a service provider of the clinic, but we see a lot of colleagues joining here from different country offices and locations that might be the users. So I want to start with Alessandra and the team. Flavia, if you don't mind, if you can take off the slides, please, so that we can bring the team back on the screen. Alessandra, maybe we can clarify the first part to all colleagues, that if you are a user of the clinic, do you need to have your agency signed an agreement in order to start using the services of a clinic that is using the UN Booking Hub, or the colleagues can just check whenever they are as part of their Booking Hub application, depending if there's a clinic in their own country office or on the field mission, they can utilize this? We'll start with that, then we'll go to Gulnar and other questions.
Sorry, I said I'm handing this over to Flavia because she's really our service manager. She answers questions like these every day to colleagues reaching out. So Flavia, over to you.
Thank you. And so as a user, the use of the UN Booking Hub is absolutely, that doesn't require any agreement. So the user can just log in and see the services that they can access. As I was saying in the demo, Each service has a customized visibility. This means that when I log in with my account, I only see services that I have access to. And of course, if I see a service, it's most likely that I will be able to book it. In terms of medical services, I can say that in my experience, usually there are agreements in place at the local level to access the services within organization, but this is not always the case actually. If an organization wants to put the medical service available to all, we can do it, as James was mentioning, even for NGOs if this is the case, so if this is the need. And then, of course, the dealing with if there is a cost or the access to the service will be managed by the service provider. But in terms of platform utilization, absolutely not. There is no limitation for us, for users, so final users. Thank you, Zamir.
Perfect. Thank you so much. And let's go to Gulnar. Gulnar, allowing your mic and video. Just comment, please. You can unmute yourself.
Hello, colleagues. Thank you so much, Flavie and colleagues, for the presentation. This is a great service. So my question is, what support and training are available for field staff to implement and manage the booking hub locally? Thank you.
Thank you for the question, Gulnar, and for the kind words. And so I'm happy to say that. So first of all, I'm the main person managing this change management. Let's call it for services adopting this platform. And not only we follow from the very start. Of course, we give live trainings, live support, and we're always available to support. But we also provide a wide range of materials so that the service manager don't always need to rely on us, but they have their own set of tutorials, specific tutorials on specific sections, general trainings recording, manuals, PDF, and we cover everything. So as you have seen in the demo, I didn't have time to show everything and it's really long. So that's why we create usually pills of little tutorials dedicated to specific, for example, on the operating hours only, so that we can provide a wide variety of examples and help the adoption of the platform. We also have tutorials and manuals for final users, so for patients. And this is something that at the beginning, especially when the system is implemented, can be needed because patients, they're not used to it, unless they are our clients on another service. And as you will see yourself, is quite easy to use, but if this is needed, we also provide help on that, also on customized materials. So we are really proud of our customer support in this matter. So if you are interested, please reach out to us and we can have a bilateral discussion and see how the platform can help your needs.
Thank you so much. Thank you so much, Flavie, for answer.
Thank you so much, Flavia and Gulnar. I can see another hand raised, and I know that Oza is coming up next with questions after this. So let's open the floor to Noor, our colleague from WFP. Wally, your mic and camera is active.
Thanks, Zamir and colleagues. Good morning, good afternoon. Thanks for the presentation and sharing this product. Excellent. Very much really needed in the field. My question is around the security of the data following what happened recently in August, that the data breach started with Yemen, then that was expanded to a few other countries. So I think that was like eye-opening for us in IT in terms of security. We are looking into two types of security. One is the connectivity security, which has nothing to do with the platform, that we are responsible to make sure we provide secure link accessing the platform. Usually we have our own local VPN, but unfortunately the data breach happened when the data was accessed on the cloud and the data was downloaded. So my question is, just out of curiosity, where the data is is located, and once the connection is linked and we open the platform to provide info, there might be some confidential data about staff member health condition. So how can we ensure that that data is safe and will not fall in the hand of unauthorized people? Thank you.
Okay, let me come in from the beginning and for the opening of these answers, and then maybe handing it over to Flavia for continuation in case it's needed. Well, first of all, as you know, we are the reason why we are one of the endorsed global shared services from the big, and we presented 3 times actually at each HLCM throughout the years, is because we are committed as the UN booking up, because we are providing service to so many agencies, to be 100% compliant with all the WFP and UN, because of course we need, as any other UN agency, we are following the policies of data protection and even data privacy. Let me even address this issue, because, for example, I think everybody might know, but we are I think the only GSS right now which is working. It's perfectly up and running the data anonymization, for example, policy that is actually, let's say, also published in our terms and conditions. We can also discuss about it. It took a lot of investments throughout the years and a lot of effort, but that was a prerequisite for us to actually offer the service in confidence to our operations and to, of course, operations of other colleagues. So first of all, specifically for medical services, we had developed 3 levels of encryptions, okay, because we wanted to actually make sure, and we all know that medical data is classified as the most important, let me say, level of privacy for data. And even the fact that somebody is booking a medical data, just for everybody to share, this is already considered the 3rd level, the highest level of data privacy to be protected, right? So we have worked a lot together with our wellness division and our, of course, GPO on making sure that we have specifically for medical 3 levels of encryption, so that makes it probably the safest service in terms of the latest let me say, standards of data protection and data privacy, right? So, and we are committed, by the way, to always follow the most restrictive rules, because that's, I think, the only way in which we can, in true confidence, be able to, offer the service also to other agencies. And this is also has been scrutinized by some of the conversations that we had at the HLCM level in the past, because that was, as I probably mentioned already, a prerequisite for other agents to say, we feel safe to provide services through your platform. So that is to say that we are very much, let's say, aware of, by the way, for everybody also to know, we are actually conducting a secret, actually last year we did only one, but let me say, cybersecurity attack to our solution. So we pay an external agency for them to, whenever, without telling us when, they actually try to hack our solution, because that's the only way for us to know if we are really, confident of breaches. And I have to say, every time, of course, technology evolves, even in terms, unfortunately, of cyber attack technologies evolves. And so we need, and we are committed to keep up with the latest. And so when we conduct these let's say, testing simulation, then we are sent the report. And then if there is anything to be acted upon to be improved and so on, we work with our IT colleagues to make sure we improve it. So in terms of that, we feel like we are, let me say, doing our best. And even when there were like some data breaches, one of the first things that we did, we actually alerted the operations, and we made sure that everything was up and running from our side. So on that sense, I think we are really, really sturdy. And this is also the reason why, in true confidence, we can offer services to other UN agencies. I don't know if, Flavia, you want to comment on anything else?
I think you said it all, and it's true. I mean, besides, of course, encryption and data security, we also have data anonymization, as you were mentioning. So for medical, service data, we have the shortest one, let's say, in terms of data anonymization and data archiving. So everything is actually more is exceeding UN requirements in terms of data.
Indeed, it's true. It's exceeding your requirements also because we are taking the European, let me say, privacy laws as one of the, let's say, requirements, which is not a given in the UN. But knowing that that is a more restrictive protocol, this is the one that we are looking at to trying to be outstanding. So we are really feeling safe on that side and point of view. And in fact, we never had issues of data breaches as of today. So after more than 10 years of operations. Over.
Thank you, Alessandra.
You're very welcome. Maybe we took too long on this question. I'm sorry, but I thought it was important that we clarified. So maybe we have time for an extra quick question if there's any.
Yes, Alessandra. We have a couple of questions. I found this really interesting. So firstly, actually, I would like to ask a question to the Dr. James, but also I have a question for you later about the fees. But let's start with James now. So I'm very curious about how the Booking Hub has impacted your resource allocation in your specific clinic. How do you see that evolve in the future using the tool? Over.
Yes, so I think, of course, in this era of resource constraints, it's very difficult to add on new hands to the team. But how it helped us is that with a view of the demand for the specific services or the different services, and also being able to give flexibility to, say, booking time, and having that instant booking solution work for the client, we had to look inwards, and in a team of just about 4 doctors, with beyond primary care work, you have your medical administration. We have to cover what you call the CITSEN or Medivac 247. We have to provide other occupational health and safety work. We now had to relook at how we cover the primary care demand, and so staggering how we attend to clients who will be coming in for consultation, and as such, have our own calendar separate from the hub, so that there's always an overlap and not one doctor seeing clients all week or all day, and have different people work and see clients at different times. Sometimes clients also have a preference. They might want to see me or my colleagues, and we can put the remarks there. And so that also helps us now look and see, okay, let them know that on this day I'm available, and so they can select that specific time. Same for the counselors, and same for the nurses. Again, always with the different service lines, we are able to allocate a nurse to do a specific task. Like, for instance, the nurses give vaccinations. They run our ergonomics workplace assessment program. And so you'll have a nurse allocated to cover all the cases requesting for an ergonomic workplace assessment, and also those who will be coming for vaccines. So you assign the resources based on the bookings for the day. Thank you.
Okay, very interesting. And
yes,
then now, yes, of course.
I just want to mention that the core benefit of this application is really we are not as touching anything specific vertically and technical on health management and medical management. We are only, our aim and our vision is automate as much as possible the organization of a modern, efficient medical service, which is taking away and automating all the manual processes for somebody to request a service and get that service. Then we hand it over, of course, to the medical technical aspects, but our ambition is to make the entire process completely automated, in support and dedication to the fact, as we were just, let's say, explained, to dedicate medical resources and nurses to more important tasks, which are related more to the medical aspects rather than the administrative part of managing a visit. Over.
Yeah, super interesting. Actually, I attend to the clinic that we have in my local office, and then that's true. sometimes the nurses have to reply to the emails, right? So that's not great. So on a different note, I'm quite curious to see how the service is being charged to the entities that are deciding to implement it. If it's WFP charging some kind of progressive fee, or if it's a standard or annual type of fee. How does that work? Over.
Thank you. So you should mention the UN the medical booking solution to your own clinic in your local office.
Yeah, we can make that connection.
Absolutely. You can share my contact. No, thank you for the question. And yes, so there is a so our model is to first understand if the client is happy with the solution. So what we offer is a completely free pilot, no strings attached. Anybody can contact us. We can set up a dedicated demo. We can set up the platform for them to pilot it so that they will start using the system and see how we need to tweak it. James was mentioning that it took us a while because of course they have a wide variety of services, and we set up the platform, and then we always made the little adjustment until the platform was suited for their needs. So this is what we offer, and then if the client is happy, there is a global agreement that needs to be signed with us, of course. With a cost that depends on how many services. So there is a baseline cost, and is early and is not progressive. So is a standard fixed fee per year. Then, according to how many services an organization has, of course, we can let's say we can adjust the final pricing. So it depends. There is a baseline, but then of course for agencies who have a lot of services, either globally or country-based, we can adjust the pricing based on that. Fantastic. But the pilot is completely free, so we're happy to set it up and also see the advantages, no? And if the cost is worth it, let's say.
Yes.
Amazing. Thank you so much, Flavia, Alessandra, Clementina, and the team for joining us today. Alessandra, if you have any final words, Clementina, to share with the colleagues. Otherwise, we're good to wrap up.
No, we are all good, and just let me know that working together with colleagues in the UN is really exciting. We love our work because we find new opportunities and new ways of working every time that we engage with somebody. So very willing to start a conversation with everybody, when anybody wants even to pilot and test the service, because you learn and you progress and improve and grow together. So happy to engage with whoever is interested.
Thank you so much. And colleagues, don't forget that next week we have another amazing digital transformation service and webinar on the UN Digital ID. That is hopefully the future of our digital identity system in the UN. And we look forward to have you join us this session as well. The invite was shared along with the other webinars. So thank you so much, Alessandra, Flavia, Clementina, Jose, and all colleagues on the organizing side, and the colleagues that joined us and asked questions and listened it. We'll share with you the recordings and a comprehensive Q&A that was from 2 identical sessions for medical and wellness services, and contact detail of Alessandra, Flavia, and Clementina and the team. All the very best.